Hi, friends. So, I wanted to come on here today and just give you my perspectives of the pandemic from a public health viewpoint. And I have some alternative views, I guess you could say, outside of the big narratives of public health agencies. But I also have dealt with long COVID. I've come into contact with people who are injured by the shots that were developed. I've had some different experiences and that have informed a lot of my perspectives today. But I myself have been getting over a virus, so I have been treating that, and I finally am at a point where I can actually talk long enough to talk to you. So I figured I'd have a coffee chat with my coffee and be able to share with you what is in my heart. This is not a really heavy data-driven conversation. I'm going to give you some resources that you can go to check out the data, and I think that that will be helpful for you. But I'm also recovering from a lot of brain fog, and I think as an introduction to this subject, I think it's best to just share from my heart some of my observations in my fields that I made. And I want to stress that I believe that God is going to carry us through. Let me take a sip here. And so it's very important that you understand about me that I come from a Christian worldview. I always have a faith-based perspective in public health, but I also was very traditionally trained. I am a community health educator by profession. I have a PhD in that specialization. And so I'm used to taking a look at data and analyzing it and developing health education programs from that. So that is my personal area of expertise. I have done research on HIV, AIDS, various chronic diseases, and now I've been looking more and more at long haul COVID because of my personal journey with it. So to give you a little background, in the beginning of the pandemic, I was your very typical public health professional. I always went to the journals to get my information, and I really respected the CDC and the NIH and the World Health Organization and all of our public health agencies. They have been the backbone of a lot of our own research. And if I've published something, I've always used them for background data, okay, to make an argument for whatever research I was doing. So you have to understand, in public health, they're like the creme de la creme of data collection. And whether it's worldwide or whether it's nationally in the United States, we have these huge agencies that collect data, and we rely on that data for everything that we do, from deciding what we're going to research to what kind of programs we're going to develop, how we're going to help communities, how we're going to reduce disease in populations. So this is my perspective. I was also pro-vaccine. I really believed in all of my research and learning that they were very helpful in preventing diseases, especially the infectious diseases that many of us confront throughout the world. I myself had lots of shots. I was getting the flu shot every single year, particularly in the last 10 years. I was getting the flu shot because I had a really bad case of the flu one year, and I said, that's it. I'm going to get a flu shot every year. Even if it wasn't always targeted well, I thought, why not? Let me just try to prevent the flu if I can. Still got sick a lot, but that was what I promoted. And at a couple of years ago, I had a family member who was dealing with a child with autism, and she was talking about the vaccines, and I looked up an article with Dr. Andrew Wakefield that was later retracted in The Lancet, talking about a connection between vaccines and autism. And because it was retracted, I just blew it off. And so I was very pro-vaccine all throughout my adult years and my career until we arrived at the pandemic. So when the pandemic occurred, no one knew what to do, right? And we're all wondering, what is this new illness that we're all facing? And so I, like many, thought we needed to have a national emergency, an international emergency. I supported the lockdowns for a short amount of time, but not too long. I thought the masks worked for a very short amount of time before I realized they didn't work. And I started to make some interesting observations though, because I got COVID very early on. That we didn't have enough tests for people. That's how early it was. I think it was late February of 2020 to early March. And at the time, there were people in lines trying to get tested for COVID, and there were not enough tests for everybody to test for it. And so I opted to just simply treat myself based on my symptoms. And it was at that time that I questioned why we had insufficient testing. I was like wondering, okay, if they have the tests, why is this such a slow rollout of testing for something that we have? And I started looking at the CDC and the NIH and a lot of our public health agencies, the WHO, and they started to not make a lot of sense to me. And I started to question, without going into a whole lot of detail, I started to question the data that they were presenting to the public. I felt like they didn't have a good handle on things. I wondered if they even understood what COVID was entirely, if the data that they were giving us was reliable. And I'll just sum it up that way. I got a sip of my coffee. So I started to just question a lot of the public health activities. I started to question how things started to get very draconian very fast as well. And then what really caused me to question things was the suppression of early treatment. So I started listening to some frontline doctors, an ER doctor, Dr. Simone Gold, Dr. Peter McCullough, others who were doing research. Doctors everywhere in Italy, in the United States, all over, were trying to talk to each other and figure out how to treat COVID. And they started to understand patterns of symptoms and the progression of the illness, and realized that there was data available suggesting that hydroxychloroquine, ivermectin, other such drugs could be repurposed for the use of treatment. And I started to think, well, gosh, if HCQ, hydroxychloroquine, was helpful in the previous SARS pandemic, and it was very similar, what we understood, to the current one with COVID, then SARS-CoV-2, then surely it would be worth trying. And then I noticed that instead of everybody getting together and saying, let's do whatever we can, let's throw the kitchen sink at people's symptoms, let's try whatever we are able to do. Instead, there was an immediate retraction in the medical community. It was, go home, don't get treatment, there's nothing you can do, come to the ER if you can't breathe. And there was no attempt to help people. And this is the point where my husband and I started to scratch our heads and go, there's something really not right. So fast forward, we're watching this, and we're also seeing that some people are getting access to some of these drugs, these very cheap repurposed drugs. And they've been around for years and years and years, FDA approved. Doctors have been using have been prescribing off-label for years if there's a mechanism of action with that drug that helps with a particular symptom. So why not try it, right? Because people were dying. So we started to see that there was some success. We saw Dr. Zev Zelenko over in New York, who had a town of 35,000 people in an outbreak, and he started using hydroxychloroquine. He used zinc to get he used the hydroxychloroquine to get zinc in the cells. So he was using that. He was using azithromycin because it had antiviral properties, and he had a whole series of vitamins to improve the immune system, and it sounded reasonable to me. And so I thought, why aren't we doing more? Why are we telling people to stay at home? When I had COVID, I was sick for several months. I couldn't seem to kick it. And looking back on it, it was because I had a lack of access to early treatment. It was early on, and that happened to not just me, but now there's many people who dealt with a lack of full recovery because of not getting early treatment and the spike protein, therefore doing more damage to the body. So anyway, so we started to question things, and I particularly was wondering about the data that was coming out of the CDC. I was wondering about their recommendations because I thought they were absolutely insane that you wouldn't treat somebody who was sick, that you would send somebody who couldn't breathe home. This manifested too in my husband's telemedicine practice because all of a sudden they told the doctors what they could and couldn't prescribe, and something like a Z-Pak all of a sudden became taboo. Whereas he's a family doctor, had been prescribing Z-Paks forever. And so it was all bizarre. And he had people calling on the phone who couldn't breathe. Their oxygen saturations were in the 80s. And my husband's begging them to go to a hospital. And everybody's scared to go to the hospital because they think they're going to die. And we're sitting here thinking, wait, but we've heard these doctors say that there are some drugs that they can do that prevent them from even getting to this point in the disease process. So I would say 2020 was a year of waking up to a lot of things not making sense and looking at public health through a different lens. When we started to have mandates and the shots rolled out and all the drugs were really withheld that were repurposed and they were demonized in literature, I started to see, there was one particular study I remember where, this is the brain fog friendly version, but there was one particular study, I believe it was in the New England Journal of Medicine, but they were saying how hydroxychloroquine was not safe. And a lot of the studies were like either giving too high of doses to the people or insufficient doses, and then they were claiming ineffectiveness. And in one particular study, they just made up all the data. And so when researchers asked for the data, they had to retract their article because they didn't have the data to support what they were claiming that it was dangerous. Same kind of stuff happened with ivermectin. And so essentially we realized that there was a problem with the research side of things as well, that things were not being highlighted in an unbalanced way. And we started to look into conflicts of interest. And once we did that, we realized there was a revolving door between governmental agencies and big pharma, and including the FDA. And so we started to just realize over time that we had a problem, that it was not a reliable system that we had, that all the decisions being made were advantageous to big pharma and not to the individual person. With respect to the shots, I developed long COVID, and after about a couple of months, so from March of 2020 to about July, I had a real rundown feeling. I felt like I was running a fever, and it took a long time, and that's because I didn't get early treatment. And so therefore, the spike protein caused this huge inflammatory response in my body, and it ended up being an issue that it was difficult to clear the spike protein, okay, for me. So fast forward to October of 2020, I decided to go ahead and get my flu shot because I thought maybe this will help me. And within 2 weeks, I started to have fibromyalgia. I started to have serious brain fog. I started to not be able to lift my arms and legs. I started to have tachycardia, developed POTS syndrome, where when you stand up or change positions, your heart rate goes wild. And so I developed all of these things right after I got that 2020 flu shot. So if I have long COVID from the spike protein, if I have injury from the flu shot, if I have both, I don't really know. But this is just my story, guys. I mean, there's no way for me to really know. So given that, I was not going to get the new shots, the experimental ones that were coming out for SARS-CoV-2. And I had also, my husband and I had done some research on mRNA technology because we wanted to see, is this something that we can actually recommend that's safe? Because it was new, it was brand new. And what we discovered was in the past, there were a lot of animal studies where they were seeing something called insertional mutagenesis, which is basically where they were having problems with the DNA, with the mRNA getting into the DNA. It didn't degrade properly. And so then the animals like rats or mice or different kinds of animals they used were having all kinds of crazy problems and injury and death and things like that. So we were concerned that it was too new of a technology and we didn't have enough information. We didn't have enough data from long-term clinical trials. And me being in public health, I knew that any kind of development of a product takes years to not just establish whether it works, but also whether it's safe. So we were both in the camp of wait and see when the shots were rolled out. And because of my condition and all the problems I was having health-wise, I basically used common sense and ignored what I was told that it would help me, and decided that I would wait and see if it would actually help me, because nobody did research on my conditions to be able to tell me whether it would help me or not. And that was my issue, is that they were telling people, different groups of people, that it was safe when in fact no research was done on those groups. And it was so quick, and it was the clinical trials that they did were really, I mean, we just didn't have all the information we needed to know both short and long-term safety data and efficacy data. Well, the last 2 years have been really challenging, because my husband and I have really awakened to the fact that our agencies are captured by Big Pharma, and that a lot of studies are funded by Big Pharma. There's a lot of conflicts of interest. There have been thousands of papers that were in preprint, but they retracted them or wouldn't allow them to be printed because they went against the narrative that has been going across the media and across the governments and all that kind of stuff. And so it's actually really hard to get good data. Pfizer was involved in litigation and was forced to release documents. And I know that dailyclout.io has about 3,000 scientists, doctors, lawyers, professionals who have poured through their preclinical data prior to putting the shot out. And one thing that they discovered in researching it was that COVID was a side effect of the shot, and that they knew that the efficacy waned within a month or so, if I'm correct. You'll have to go to the data and read it to check me on that, but it was very short amount of time. In other words, they knew it didn't work and they rolled it out anyways. And so, you know, this is the point I'm making, is that I lost confidence in our federal agencies, and it's difficult because the academic institutions are funded by them. Everybody's funded by Big Pharma. I mean, it's everybody gets a paycheck, and so people toe the line and maybe fail to ask appropriate questions because of the nature of what that would mean if their conclusion is different than the narrative that's being presented to the public. So I share all this with you, not to put you in fear, but to just tell you my own perspectives. And dailyclout.io has a lot of the Pfizer data and a lot of reports that people have done pouring through what they did prior to releasing the shot to the public. And there were a lot of deaths and a lot of injuries, and they didn't report it. Informed consent, in my personal opinion, never really happened. So my conclusion is that a lot of people lied, and then a lot of people trusted what they were being told to be the truth. So then this leaves us in this quandary now of what do we do? And first of all, I believe in the power of prayer, and I believe that God can help us navigate out of the situation that we have been in. There is treatment. My husband has been treating patients with early treatment with safe, repurposed drugs. None of them have gone to the hospital. They've all done fine. And I've taken it now myself, and it's helped me. And a lot of those same protocols that I'm going to say it, FLCCC, they're the frontline critical care doctors. If you look them up, they have protocols from all of their experience, and they have a lot of studies on their website. Pour over it, because that's another great resource. And they talk about vitamins, getting your vitamin D level up, your vitamin C, how you can take higher doses of vitamin C to reduce inflammation in the body. I mean, they have wonderful information. And that was one more thing that was suspicious to me. When you start talking about not taking vitamins and you say that they're not effective, I question the narrative, because you don't make a lot of money off of that. And yet there is a lot of data. There's a lot of data out there about improving the immune system with vitamin supplementation and also the gut microbiome, getting your gut healthy and having enough good bacteria because it's part of your immune system. I mean, proper nutrition. I mean, there's a lot of things we can do, everyone, that isn't really being talked about, which is concerning to me, but it's also an opportunity for all of us to start saying, okay, I've got to take ownership of my own health. I need to do what I need to do to get healthy. And I need to, explore different options. They've been looking at intermittent fasting or time restricted eating. Obviously, you can do it with the doctor if you've had some health issues. Just having a more limited eating window so that you can clear spike protein out of your body. Low dose naltrexone is something that I'm taking. This is not medical advice. This is just throwing some things out to you. Low dose naltrexone, at higher doses, naltrexone is used for opioid addiction. At lower doses, like between 1 and 4.5 milligrams, it actually modulates the immune system, and there's like almost no symptoms. I mean, it's so safe. And the only thing you might have is an occasional weird vivid dream, but I mean, it's been life-changing. Or things that I've learned like nattokinase, which is an enzyme in soybeans that actually breaks down fibrin, helps with reducing blood clots. If you have an elevated D-dimer, which is a clotting test, like I've been stuck with that. So I've been working on ways to deal with potential blood clots in addition to the traditional stuff that we use that might be safe and lower my bleeding risk and things like that. So FLCCC, they are constantly doing research. They're talking to doctors all over the world just to confirm. They talk to doctors in South Africa and India and Brazil, and they're looking at research everywhere. And some countries have had more openness to it. For example, in Africa, there were some countries that had ivermectin and hydroxychloroquine over the counter. They did not have the same hospitalizations and death rates that we did here in the United States. Uttar Pradesh is a province in India, and they have a little over 200 million people, and they used ivermectin and a couple of vitamins to treat early treatment, and they practically eradicated COVID in their population. So I just want to explain to you, FLCCC has a tremendous amount of data. It's FL and the 3 C's, okay? Frontline critical care doctors. And another one is the World Council for Health. They're an independent public health organization that I've been following that brings in experts to talk about research, to talk about ways forward. They not only include traditional forms of medicine, but they also really look at prevention, health and well-being. They've been really great. They have wonderful experts every week on a webinar. Some of this is maybe more, techie, more public health speak, but some of it's really great for the general public. So overall, I just wanted to kind of share my story with you and some of my thoughts. And I believe this is a time for us to become true advocates for our health. I believe it's a time where we need to have courage. We need to regain our critical thinking skills and just ask God to guide and lead us. When you have questions, don't ignore the questions that you have. Don't shove them down, because I can tell you a lot of times at your gut level, it's not wrong. A lot of times the Lord is letting you know, don't do this instead. He's guiding and leading you. And I believe, and this is my prayer, is that God will bring forth healing to everyone who needs it, and that He will lead us into massive breakthrough, and He will lead us out of a lot of the challenges that we have been facing. It takes courage, though, and it takes transparency, and it takes us as people demanding good health care, demanding truth and honesty in medicine, and also it takes us being real advocates and doing our own homework and learning how to do research for yourself and figuring out, good options to develop a better immune system, which is what I'm going to emphasize. is to work on your immune system and to get healthier in your life. And the Lord, I believe, will guide us out of this very difficult period that we've been facing. So I love you all, and I bless you, and I hope that was an interesting conversation. And I am a believer of courage. I'm a believer of the goodness of God in spite of the bad. And I'm a believer that He will comfort our hearts, give us peace, and give us hope for the future. So I love you all, and I bless you. May the peace of God fill you in the name of Jesus, and have a wonderful day.